Okay, so here are there are some statistics before we had ASF in December 2018. We have more than 31 million pigs entirely in countries. And as of yesterday, our pig population almost 25 million, as you can see from the screen. And quite similar to China, pork is very popular in Vietnamese meals. So you can see that more than 70% of our meals have the pork and pork products. And for breeding animals, before ASF, we have about 3.8 million sows and about almost 80,000 bulls. And yesterday, we received the figures that we have currently, we have almost 2.7 million sows and 64,000 bulls. So you can see there's a significant reduced number of pigs. And our topic here today is that a little bit more about small-scale pig production. So in Vietnam, we have totally more than 205 million households with pigs. It's a range from one to many, and they contribute about 65% of pig population entirely. Okay, so let me move on the ASF situation. In 2019, totally the ASF occur in entire countries. Especially it's occur in more than almost 9,000 communes. It's about 80% of total communes in Vietnam. And we have to count about almost 6 million pigs. And you can see the map on the right-hand side. It demonstrates the outbreak occur throughout the countries. But from January 2020 and up to now, more than 99 outbreaks, that's infected communes, has been resolved. And up to now, we have 44 out of 63 provinces where did not have any outbreak anymore.
Nguyen, I'm sorry to interrupt, but we can only see slide 5. There's no changing of slides.
Oh, really?
Yeah, sorry.
Still going. Can you see the map, Dr. Chabatru?
No.
Maybe you can stop sharing the screen, then share that again for the slide view.
Now can you see it?
Yes. Yes, that looks good. I think it's the same slide, but it's now showing in presentation form rather than desktop form.
Okay, so up to today, we have remained about 100 outbreaks. It means infected communes in 19 provinces. So it means that we still have outbreak currently occur in our country, but small number of outbreaks. And here we did some epidemiological analysis, so you can see here, but not much sharing at the moment because we do not have much time. And you can see here from the epi curve, so you can see that mainly very high peak is in last June and July, and then it's reduced gradually, and then up to now we have a small number of outbreaks. We face a lot of different factors related to the ASF introduced into Vietnam and also widespread throughout the nation. So that you already understand very well that we have very long borders and a lot of international travel to Vietnam. So at the beginning, the own backyard product and own outbreak occur at backyard production because they have no or very low biosecurity. But up to now, we do have some big commercial farm also infected, and they had to count many thousands of pigs. And because of non-zoonotic disease, so that right after some months, the disease introduced into Vietnam, all the farmers and even the consumers, they did not really afraid because of non-zoonotic, so that they did panic shelling, especially for Tet or festival event. And certainly similar to other countries, transportation and swill feeding, and people, and also transportation vehicle, so the key factors relate to the transmission of the disease. We also find quite similar to proportion of those factors. For example, for swill feeding, it's more than 35% of outbreak relate to swill feeding, and also for vehicle and also for people as well. So even at the beginning, before we have outbreak, we do have some contingency plan, and we do have some practice so that we ready to deal with the outbreak. So that when we had the outbreak in February 2019, we immediately can apply our control measures. Just like, yeah. And here, very important key issue, I think, for us is that we have very strong commitment from the top level of political agency. So that they request all relevant agency from top level to the down, the commune level, to work on the ASF control. Not only for those who are working for agriculture and veterinary services, but also many other sectors, even the police and soldiers, they has been requested to work with us to stop spreading of the disease. And our top level country leaders also pay attention on that, so they went around along the country to check and request relevant agency to work closely and to deal with outbreak. And here just some photos for the reference. And one of the key, as I mentioned, that we have successful up to now is that we have multiple ministry related, because we established the National Steering Committee. Is involved 22 ministry of different areas. And we have a weekly meeting so that we present the problem to them, and we request each of the relevant ministry to do action by their own plan to make sure that they can join together with us to stop the spread of the disease. And we also, because we developed our contingency plan in 2018 when we did not yet have outbreak. Therefore, we have to review our national action plan to make sure that the plan is working properly and also more feasible to the disease situation. And before I jump into the small scale, I would like to summarize what the key control measures we are applying currently. The first is that we have a strong and timely leading by highest level of the government and down to the commune level, because we now not request veterinary services are mainly responsible for disease control. We request the chairman of the committee so that he have authority and he has a power to request all relevant agency to work. That is for political commitment. So, second, for early detection and calling and disinfection, we are quite happy with the same procedure Dirk present here. So that from us, any sick pig or suspect, we request to take sample. And even when the result is not yet available, but the pig, so any clinical sign or the problem with the disease, so that we can apply scouting strategy immediately without waiting for testing from that pig. For small farms, especially here today, we would like to discuss a little bit. The first, also very early detection. How we keep daily monitoring the house, the pig households, and also we run some surveillance. And also, whenever any farms they detect any suspect pigs, they have to notify or report to the local authority or veterinary services. And when any pigs identify positive or suspect pigs, so that we, as I said, that even we apply culling immediately for those infected pig or suspect pigs. And then for those house healthy pigs, we keep them separately, keep close monitoring, or either they are allowed to slaughter if we take sample and own the result are negative from ASF. So even in the same bands, the same house, if the pig are healthy and we take sample and they are negative, we allow them to slaughter, not to count. And for a little bit change in terms of disinfection and cleaning. Normally, in other disease, we often carry out cleaning first. But for this disease, because the virus can maintain for a long time and the virus can jump from one location to other location very easy by a different way. So that our strategy is that we apply disinfection with high concentration 2 or 3 times compared to the normal procedure. And then we keep for some hours before we cleaning. We apply cleaning. And certainly during the weeks, or at least 2 or 3 weeks, every 2 days, they apply the disinfection again. And certainly we also apply for other control measures as well. And we apply the compensation to those pigs that are caused because of the disease, currently about almost $2 per live kilo. And we also apply movement control as well. Certainly, only movement between the infected premise and also with other. However, within infected areas, for example, in same district or even in same communes, same district or same province, we still allow them to move animals. Because as you can see that not every pig in the same communes get infected. If we stop movement, they bring a lot of problems, so that even when we have outbreak within a commune, we still allow healthy with test negative to be moved within the communes. Certainly from the slaughterhouse, we also take sample from pork and pork products to test, and if they are negative, they are allowed to bring outside as well. We do understand that biosecurity measure is very important, but as you can see that in Vietnam, more than 2.5 million households with pigs, where they have their poor infrastructure and facility, is not easy for them to apply very good biosecurity measures. Therefore, we also have to customize or to make adjustment our control measure to make sure that it workable to those households with pigs. For restocking in Vietnam, we quite similar to other countries is that we whenever any farms where they would like to restock their animals, they need to be in the commune without any further outbreak at least for 30 days. And when they start restock, they have to keep the sentinel pigs about 10% of their capacity for at least for another 30 days. And within 30 days, either they keep daily monitoring or they have to take sample to show that they are negative for ASF before they are allowed to fully restock. And also currently, we also change our policy to allow to restock for those small households. Is that we do not allow them to restock for those farmers who close to residency areas. they have to keep at least a distance from residency area to the pig farms. And we also much focus on risk communication and also public awareness. And in our countries, you can see either from Google or from anywhere, you easily can find the information about ASF in Vietnam, because we would like to share with the public if they understand well about ASF and the dangers of the disease and also the situation, they will support us to work with that. And here, for example, there are some small farm. You can see that before any people, either they are not allowed to come into the farm or they have to apply the biosecurity measures. On the main entrance or any entrance into the farm, they put a lot of lamps, powder on the way. So that is one way to prevent the virus coming in the farm. And here there are some typical small household. You can see that now a lot of household where they still keep pigs. The first thing they apply the mosquito net to prevent mosquito and flies or rodents or rats from outside into the small pens. So you can see that. So within the pens, you can see that they keep it clean and they keep daily, not every some hours they do disinfection and clean again. And you can see the disinfection and lamp solution between the bands. So you can see that they keep the solution water with some lamps, with some disinfection, so that even the owners, they come into the farm, they by themselves to disinfect their feet as well. And also small farms. They apply that they set up designated or dedicated areas for treat their feet. Honestly, in Vietnam, we extremely difficult. We do not ban them, but we strongly recommend that do not use with feeding. But still common, so that we instruct them that they need to treat well with in feed with heat, so that they can kill any pathogen within the feed before they feed their pigs. And the last one, we strongly support that information sharing, not only within the countries, within the farmers, within the relevant parties of the country, but also sharing in fully information and data with international community is very important to work together. And therefore, we keep reporting all outbreak to the OIE and sharing the data to FAOs as well. And we work closely with our colleagues. Dr. Pawin also participate here with us for information sharing, for outbreak investigation, and for consultation for disease control as well. We also work closely with other countries to update, to learn experiences, and also to sharing how to deal with outbreak more efficiently. So that's all from my presentation. Thank you very much, and I'm very happy to share